We have the skull. The skull is composed of several separate bones which are joined together at the sutures. These are the sutures, which are immobile fibrous joints. Okay, they are connecting the bones of the skull. Between these bones, we have sutural ligaments, which is connective tissue running between these bones. The only exception is the temporomandibular joint, which is here with the mandible, which is a synovial mobile joint, and also the ossicles of the ear. These are mobile joint and are not sutures, which are immobile. So the skull is divided into bones of the face and bones of the cranium, which constitute the cranial cavity. Now, first of all, if we look at the skull, of course, with the mandible discarded, we have anterior view, superior, posterior, lateral, and inferior. First of all, we have anterior. The anterior, we can see the frontal bone. This is the frontal bone. Okay, it curves downward and forms the superior margins of the orbits. These are the orbits, the location of the eyes. Okay, so it forms the superior margins of the orbits. We can see here the supraciliary arches. These are the supraciliary arches. Okay, these are the supraciliary arches. In between them, this area is known as the glabella, and the junction of the nasal bones with this area is known as the nasal. Okay, the blue line is the nasal. Here the glabella and the supraciliary arches. We can also see the supraorbital notches. Supraorbital notches, sometimes called foramen. In this case, it's a foramen. Okay, so this is about the frontal bone. The orbits, we said, are the location of the eyes, superiorly bounded by the frontal bone, laterally by the zygomatic and the frontal bones, medially by the maxillary and the frontal bones, and inferiorly by the maxillary bone. So these are the orbits. Then we have the nasal bones. The two nasal bones, when they communicate with each other, they form the bridge of the nose. This is the bridge of the nose. Inferiorly, they communicate with the maxillae, the two maxillae, to form the anterior nasal aperture. This is known as the anterior nasal aperture. Inside it, we have the nasal cavity, which is divided into two lateral cavities by the nasal septum. This median structure is the nasal septum. Okay, nasal septum, which is bulging forward of the vomer bone into the nasal cavity. We can also see the middle and the superior conchi, okay, which are part of the ethmoid bone. The ethmoid bone is actually a bone that separates the brain from the nasal cavity. So it can be seen internally from here. So here is the ethmoid bone, okay? This is the ethmoid bone, separating the nasal cavity from the brain. Okay. So we said this is the nasal septum. These are the middle conchi, and these are the inferior conchi. The inferior conchi are actually separate bones of the face. Okay, so this is about the nasal bones. Then we have the maxillae. We have two maxillary bones. This is one of them, and this is the other one. They meet. Let us say they communicate superiorly with the frontal bone, with the maxillary process of the frontal bone, and inferiorly they unite in the medial line with each other in the intermaxillary suture. This is the intermaxillary suture. Okay, they form part of the hard palate, the anterior part of the hard palate, also the upper jaw, part of the lateral wall of the nasal cavity, and part of the floor of the orbits. So all of these are formed by the maxillary bones. Here we have a foramen, which is known as the infraorbital foramen. It's found in the maxillary bone. Okay. And also here we have the alveolar process with the other side, the alveolar process of the other side. They form the alveolar arch for the upper teeth. Okay. Then we have the zygomatic bone. This is about the anterior view. Then we have the lateral, and also is part of the anterior view. We have the zygomatic bone. The zygomatic bone, it articulates medially with the maxillary bone and laterally with the zygomatic process of the temporal bone. This is the temporal bone. This is the zygomatic process. Articulating with the zygomatic bone, it forms the zygomatic arch. This is the zygomatic arch. Okay. We have two foramina inside the zygomatic bone. We have the zygomaticofacial foramen. This is the zygomaticofacial foramen. And we have another foramen. It should be here on the internal surface of the zygomatic process of the temporal bone. It's known as the zygomaticotemporal foramen. So we have two foramina. Okay. So this is about the anterior view. Then we come to the lateral view of the skull. The lateral view of the skull, we can see in the anterior part we have, as we said, the frontal bone, which is articulating with the parietal bones at the coronal suture. This is the coronal suture because it's in the coronal plane of the body. Okay, coronal suture. It's articulating with the parietal bones. The parietal bones form the roof of this of the skull, which are articulating with each other at the sagittal suture. This is the sagittal suture, and articulating with the occipital lobes, with the occipital lobes only, this is the squamous part of the occipital lobe, by the lambdoid sutures. Okay, so here we have other constituents of the lateral view. We have the temporal bone and its parts, which is the squamous part, the mastoid part, the tympanic part. Okay, see this? Petrous part, no, not petrous, petrous part internally, squamous, mastoid, tympanic and styloid process. Okay, we also have the greater wing of the sphenoid bone. This is the greater wing of the sphenoid bone. It's a part of the lateral view. We also have the zygomatic arch. It is also part of the lateral view. Okay, in the lateral view here, internally, we have here the parietal lines. From the posterior aspect of the frontal process of the zygomatic bone, we have two lines. A single line emerges and then divides into two lines: the superior parietal and the inferior temporal, superior temporal and inferior temporal lines. Below the inferior temporal line, we have the temporal fossa. This region is the temporal fossa. And below the infratemporal crest, which is a part of the greater wing of the sphenoid, it should be here. Okay, this crest, the infratemporal crest. Below it, we have the infratemporal fossa. The infratemporal fossa is located here. Inside it, we can see the pterygopalatine fossa. This is the pterygopalatine fossa. Okay. This fossa is the pterygopalatine fossa. It communicates superiorly via the foramen rotundum. This foramen, foramen rotundum. It communicates with the brain cavity anteriorly with the orbits via the inferior orbital fissure. This is the inferior orbital fissure. Okay, inferior orbital fissure, and also with the pterygomaxillary fissure with the infratemporal fossa. Okay, so it communicates with these cavities. Then we have the posterior view of the skull. The posterior view of the skull, we can see the two parietal bones with this intervening sagittal suture, and then we can see the lambdoid suture, which separates the parietal bones from the occipital bone. Here in the middle we have the inion, external occipital protuberance. Emerging from it laterally are the superior knuckle lines. We also have highest knuckle lines, Zhuandiania, and inferior knuckle lines. Okay. Here, this is the mastoid process. So this part is known as the occipitomastoid suture. This suture, occipitomastoid suture, and we have the parietomastoid suture here. Parietomastoid suture. Okay. Then we have the superior view. The superior view of the skull. We can see the frontal bone. We can see the two parietal bones, coronal suture, and the sagittal suture. Sometimes here we have metopic suture. 3 to 8% of the population we have a metopic suture in the midline of the frontal bone. Here we have parietal foramina. These are parietal foramina. And the sagittal suture in between them is known as the obelian. This part is the obelian. This part is known as the brygma. Yes, brygma is the connection between these bones. It's also known as the anterior frontanel. In the fetus and the early newborns, it is not completely fused together, so there are spaces here. And posteriorly, here we have the lambda. Also, just like the anterior frontanel, we have the posterior frontanel known as the lambda. Something else about the lateral view here. This point is known as the pterion. Pterion is the meeting point of the four bones, which is the anterior inferior part of the parietal bones with the frontal, with the greater wing of the sphenoid and the temporal bone. It is edge-shaped, okay, and it is the weakest point of the skull, and also behind it lies the anterior division of the middle meningeal artery. The middle meningeal artery is here, okay, middle meningeal artery. This is the groove for it. So this is the weakest point. Also here we have the asterion. Also another weak point known as the asterion, but it's not clinically important as the pterion. Okay, so this is about these views. Then we have the inferior view of the skull. The inferior view of the skull, when the mandible is discarded, the anterior most part of this view is the heart palate. This is all known as the heart palate. Okay, in the heart palate we can see the palatine process of the maxilla. This is the palatine process of the maxilla. We can also see the horizontal place of the pterygoid bone. This bony structure is the pterygoid bone, okay? Palatine bone. Horizontal place of the palatine bone. Anteriorly, we have here, this area is known as the incisive fossa. and inside it we have the incisive foramen. Okay, this is the incisive foramen. Posterolaterally we have the greater, these are the greater and the lesser palatine foramina respectively. So the larger one is the greater, the smaller one is the lesser palatine foramina. Above the posterior margin of the heart palate, we have the quini. Quini are the posterior nasal aperture, which is separated from each other by the vomer, posterior edge of the vomer. This is the vomer bone, which forms the nasal septum. These quini become continuous with the medial pterygoid plates of the sphenoid bone. These are the medial pterygoid plates of the sphenoid bone, and these are the lateral pterygoid plates. كويني نازل كده كويني كويني شجع أوان posterior nasal aperture حموي يعني أوان لقى أوان okay. Here we have in the medial pterygoid plate we have the pterygoid hamulus. These are the pterygoid hamulus, okay, this structure, bone structure. Okay, then the lateral pterygoid plates, we said posterolateral to them we have the foramen ovale. These are the foramina ovale on both sides. Structures pass through this foramen ovale, which are the maxillary nerves. Then posterolateral to it we have the foramen spinosum. These are the foramen spinosum, mandibular nerve, sensory and motor roots pass through it. Then posterolateral to it we have the spine of the sphenoid. These are the spines of the sphenoid. One on this side and the other on this side. It's more clear on this side. Okay, spine of the sphenoid. Then we have, this is the mandibular fossa, and this is the articular tubercle. They form the upper part of the temporomandibular joint. Because the mandible comes here, so this is the upper part of the temporomandibular joint. Separated from the tympanic part by a groove here, which is known as the auditory fissure. Sorry, the auditory fissure, this is the auditory fissure. Okay, separating it from the tympanic part. Here, this is the external acoustic meatus. This is the suprameatal triangle, and this is the styloid process. This is the sheath for the styloid process from the temporal bone. This area of the temporal bone is known as the petrous part because it's pitted. Okay, this is the petrous part of the temporal bone. In the inferior part of the petrous part, we have the carotid canal. This is the carotid canal. Okay, this one is the carotid canal, this is the other carotid canal. From here, the carotid artery emerges. Then, in the lower part, or let us say medial to the styloid process, we have a deep depression in the petrous part of the temporal bone, with a shallower depression on the occipital part of the occipital bone. They form this foramen, which is the jugular foramen. Diara? Jugular foramen, أو يكك أليرة. Okay, أوش أويش. Jugular foramen. In between the styloid process and the mastoid part, we have the stylomastoid foramen. This is the stylomastoid foramen. Okay, stylomastoid foramen. Then here we have the area in between the posterior edge of the vomer and the foramen magnum. This is the foramen magnum. This area is formed by the body of the sphenoid and the basilar part of the occipital bone. This is the basilar part of the occipital bone. In the middle of it, we have the pharyngeal tubercle. This is the pharyngeal tubercle. There, above the, or let us say because anatomical position is downward, so below the foramen magnum we have the occipital condyles. The occipital condyles articulate with the superior articular faces of the atlas, which is the first cervical vertebrae. Okay, posterior to it we have the condylar canals or foramina. These are the condylar foramina. And here in this part we have the hypoglossal canals. Okay, this is the hypoglossal canal, and this is the other hypoglossal canal. They convey the hypoglossal nerve, which is the 12th cranial nerve. This is known as the mastoid foramen. Okay, one mastoid foramen, this is the other mastoid foramen. And here we have, in the junction between three bones, which is the petrous part of the temporal bone, the occipital, the basilar part of the occipital bone, and the greater wing of the sphenoid bone, we have this foramen, which is known foramen as foramen lacerum. Okay, this is the foramen lacerum. Okay. Then here we said we have the external occipital protuberance or inion, and here we have the external occipital crest. ماشي بس يكش معه orbits. Inside the orbits we have the optic canal or optic canal يعني circular aperture optic canal. Okay. Below it we have the superior orbital fissure, and here we have the inferior orbital fissure. This groove is known as the infraorbital groove or infraorbital groove or inferior orbital fissure, superior orbital fissure, نقدر optic canal. Okay. Our bone, this bone is known as the lacrimal bone. Shinaka, lacrimal bone. This bone is the greater wing of the sphenoid bone. This is the orbital plate of the frontal bone, awash of the temporal bone, awash of the maxilla. Okay, so these are the walls too. ماشي أول تمام. Yesterday now cranial cavity. Cranial cavity for descriptive purposes it has been divided into three parts: anterior part, middle part, and posterior part. The anterior cranial fossa is separated from the middle cranial fossa by the lesser wings of the sphenoid bone. These are the lesser wings of the sphenoid bone. It lodges the frontal lobes of the cerebral hemispheres, and in the middle we have this is the frontal crest. We have the crista galli, which is upward projection of the ethmoid bone for the falx cerebri. Okay, crista galli. Here we have this is the cribriform plate of the ethmoid bone, and these are the orbital plates from the frontal bone. On the either sides of the crista galli, on either sides of the crista galli, we have vertical slits for the anterior ethmoidal nerves. Okay, anterior ethmoidal nerves. يعني ده بي أليربن أو ده بيلر يكك أليربي anterior ethmoidal أو يديش أليربي anterior ethmoidal nerves. Posteriorly foramina. Posteriorly أليرا in the junction between three bones, sphenoid, lager frontal, lager ethmoidal. We have the posterior ethmoidal foramina for the posterior ethmoidal nerves. ماشي. تيديش أليرا توا. Then we have the middle cranial fossa. This bony structure is known as the sphenoid. Sphenoid resembles a bat or a butterfly in which it has a body and it has two types of wings, smaller wings and greater wings. Yani lesser wings and greater wings. So here in the middle cranial fossa, we have lateral expanded parts, and we have a middle smaller and concave part. The concavity here is known as the sella turcica. Sella turcica, it receives the pituitary glands, and sometimes the lower part of the hypothalamus. So this is the sella turcica. Anteriorly, it has a, let us say, like a bulging forward, which is known as the tubercular celli. This one, tuberculum celli. Posteriorly, you have the dorsum celli. Okay, tuberculum celli, dorsum celli. The dorsum celli, it has posteriorly two tubercles, these tubercles known as the posterior clinoidal tubercles, for the attachment of the tentorium cerebellum. Anteriorly, we also have these are the anterior clinoid processes for also attachment of the tentorium cerebelli. Okay. Laterally here we say we have the expanded parts formed by the parts of the sphenoid bone and the temporal bones. Here we have some fissures and foramina. This is the optic canal. Okay. अगर तमाशा एरज बके. Sorry, no, optic canal. Oh, optic canal. Oh, optic canal. Which convey the optic nerve. Optic canal alera أو يدش alera. Okay. Okay. يعني below the lesser wings alera immediately أوها like the course of the pen optic canal here. باشا. أوش superior orbital fissure. هذا ديارني أوها. fissure كي alera superior orbital fissure. باشا. هذه أول سبب. Vale. Our foramen rotundum, which communicates with the pterygopalatine fossa. Foramen rotundum. ماشي. أو أنا foramen ovale. أوش foramen spinosum. Foramen ovalis, foramen spinosum. أدي أو بنزواتيا. أو foramen lacerum. Okay. Foramen lacerum. أو هيك أو يديش أو foramen lacerum. Okay. يارا. foramen lacerum. ماشي. أدي أو. أوش ده بيكاروتيد بي. أو كاروتيد. أو كاروتيد كان على كيا. ماشي. أليرا كاروتيد كان. أوش كاروتيد كان. ماشي. أوش جوجيلار كان. جوجيلار فورامين. أو جوجيلار فورامين. يعني هيك لا بس أو جوجيلار فورامين كيا. ماشي تسيديش أليرا. قلتي أليرا superior petrous sinus هي. وانفيريور ليش أليرش قلت inferior petrous sinus لسر أو سوتشري. ماشي هو in the middle cranial fossa هيك. Posterior cranial fossa it lodges the cerebellum, the pons and the medulla oblongata. أليرا we have the foramen magnum. ماشي foramen magnum. أوش ده بي أو بي. Osh condylar condylar canals. Okay. Alerish we have the hypoglossal foramen, condylar canals, internal occipital protuberance, or internal occipital crest. Masha. Alera, the internal occipital protuberance, we have the transverse sinuses, which then become the sigmoidal sinuses. Our sigmoid sinus, our transverse sinus. Internal occipital protuberance, internal occipital crest. Uzam her önde. Her önde.